Assalamu alaikum, Dr. Ammara. Thank you for taking our time and joining us today. I am Wajiha Dishan, and along with me we have
Azeen Shafiq.
Before starting the interview, we would like you to grant us permission for this interview.
Yeah, my name is Dr. Ammara and I'm head of department in Jinnah Hospital. I've been working in this field as a psychiatrist for the last 18 years. So yes, you can.
Okay. So we are a group of Global Perspective students, O-level student from Beacon House Berrytown campus, conducting research under this topic. So we'd like to ask you a few questions about it.
First of all, to begin this interview, I would like to ask, as you know, that for not only physical but mental growth, proper nourishment and nutrition is required. What are the adverse effects of undernutrition on a person or child's mental health?
If we talk about the person or a child's mental health and the nutrition, so if we talk like growth of a child, that is very mandatory. If we are seeing the growth rates when the child is being born, the growth rate is maximum in the brain and the slowest in the body. And with the best of time when child grows, there is an age come when brain has to have more energy and more carbohydrates and proteins to have development of the personality. So if malnutrition is there, it's going to affect the overall growth of the body and the brain, which then leads to multiple psychiatric disorders in the child or maybe emotional disturbances.
Through an online survey that we conducted, we found out that even people who are well off and aware of nutritional facts are malnourished because they choose to eat food that isn't healthy. Why is that?
Okay. So you said you're conducting a research which is saying that the clients who are well off, they take unhealthy food which actually affect well. It's actually not the well off or not well off. It's depend upon the choice of the food they are using at the time. This actually at times depends upon the mental state or mood of a person, what kind of food they can take. So when the persons who are well off and they are spending their time and they are not taking proper sleep, they don't have a proper routine of the life or sedentary life, they usually wake up at nights. This is a normal pattern they are having, and then they start going for the food which is actually rich in the carbs or maybe like fried type of a food, not healthy, means the food which is not having a balanced diet. So that's why they are having this pattern of eating in them.
During research, we learned that malnutrition triggers anxiety, depression, poor sleeping patterns, etc. Have you ever encountered a patient who had mental illnesses except eating disorders due to malnutrition or their eating habits?
Yes. Okay, if we talk about the eating disorders, that contain two types of disorders, that is anorexia nervosa, which having the very less food intake, and bulimia, in which there is over intake and followed by the vomiting and all that stuff. Yes, we have the psychiatric patients who do have these problems related to the malnutrition. At times, the patient who are suffering from depression, in their phase of acute depression or in severe state, they do have the habits of having less food, that is they are going to have reduction in their weight, followed by they do have some increased amount of food which is actually going to cause the weight gain, and further decreased energy levels can lead to the disturbances. Now the malnutrition itself affect the clients. For example, if you talk about the keto diets, which is a very tough diet and very common actually being used by the adults or adolescents, especially girls and boys both. So it happens like they do develop malnutrition with the other type of normal and balanced diet, and they do lead and end up in kind of like anxiety, depression. At times they do develop mood disorders or emotional outbursts.
Okay, so we conducted another interview previously, and in which doctor mentioned that managing stress will help manage malnutrition rates. Can you recommend how?
Okay, stress management is very important. Usually we as overall, if we see our lifestyles, we go on the things like on urgent basis, that we make every task in a list of urgency. If we keep everything in urgency, our body have endorphins and then we have the release of adrenaline. So if there is excessive release of adrenaline, that's going to cause increased weight gain and suffering in the nutrition. So stress management is important, that if we divide the time into urgent and non-urgent, and most of our work should be in the non-urgent state, that help us to make our brain comfort and body to be in reliance with the brain work, because our body and brain has to work in congruence with each other. So stress management actually affect more and balanced diet and affect not to increase the weight gain or not towards the reduction in the weight. So stress management is very important definitely to manage the weight, and then followed by the nutrition.
Can you tell us how mental health is directly or indirectly linked with the type of food that a person consumes?
Yes. Most of the people who consume, as I previously explained you, the keto diets, that is the rich in proteins, and these clients or students or the persons, they want to just pretend on like the proteins, our body need carbs, amount of lipids in another form because they are going to work out. So when they are on one kind of a diet, that is definitely not going to healthy, and it's going to affect, for example, that's going to reduce serotonin, and then at times it increase the depression, at times it can increase a disorder which is called bipolar affective disorder, and at times it can cause this disturbance in sleep which can trigger on the other psychiatric disorders.
I see. Thank you for taking out time from your busy schedule for us and for this informative interview. Before we end our session, do you have any questions for us?
Yeah, I have a question. When you are searching online about all these questions, I hope you have gone through the data which is randomized controlled trials, or you must be going through the research which is actually being published rather than the unpublished. So that I suggest you to do.
Okay, thank you.
Thank you.
Thank you.
so much.
Take